Now to the latest on the coronavirus in Kern County. The virus has loosened its grip after nearly suffocating our healthcare system for weeks. But the scars run deep and become more prominent with each new update from our health department. 17's Alex Fisher joins us now with a look at the numbers. Alex?
It is evident the worst days of the coronavirus pandemic are behind us, but we're still learning how grim our deadliest days were. It has been 340 days since our first confirmed case of coronavirus. Now, we're over 100,000 cases. That means it took just 11 months for 1 in 9 people who live in Kern County to get sick. Here's a look at the journey we've been on. Our average is now below 400 people getting sick every day. We haven't been that low since before Thanksgiving. Our peak was the week after New Year's. That's when we saw an average of 1,200 people getting infected every day. The downward trend is also happening in our hospitals. State data from today shows 237 people are in a Kern County hospital with coronavirus. 53 more are fighting for their lives in the ICU. These numbers continue to slowly decline. Although encouraging signs, the spread of coronavirus is still considered high in our community, and we still have a ways to go before we see restrictions lift. Here's a look at the state's metrics for tiers. It was just updated today. Kern County is still in the purple tier. We have to lower these 3 purple bars that you see on your screen. Once we hit the red, there will be less restrictions. So that's where we are and where we need to go. Meantime, we're still learning of where we were, and it was deadly. We learned of another 23 lives lost in the past week because of coronavirus. 14 of those deaths were in December. It is just another example of how long it takes for our health department to confirm a death. The deadliest week was the week before Christmas, and the true number of COVID-related deaths is most likely significantly higher because of the lag in reporting. This virus is deadly, and that's why doctors say vaccinations are important. Data from the CDC says nearly half of people who live here have a pre-existing condition. That makes us one of the most vulnerable counties in California. A group disproportionately affected, those 65 and older. Local death data shows the virus preys on those who are elderly. Data from our local health department shows 1 in every 20 people 65 and older who contract coronavirus in Kern County have died. That is why it is extremely critical for those 65 and older to get vaccinated. We're nearing 90,000 doses administered in Kern County, and the good news is 58% of those doses have been administered to those 65 and older. Another group disproportionately affected by coronavirus, Latinos. While 53% of the local population is Latino, data from our health department shows Latinos comprise of 60% of COVID deaths. And while a majority of people who live in Kern are Latino, they only represent less than a quarter of the number of people who have received a vaccine. Over the past 2 weeks, an average of 2,900 people have received a vaccine. It takes 2 doses to receive full immunity. At this current pace, it won't be until Halloween next year for every single person in Kern County to be fully vaccinated. Alex Fisher, 17 News.